Welcome to Concussion, the podcast that dives deep into the world of brain trauma, breakthrough treatments, and inspiring recovery stories. I'm Travis.
And I'm Abby. Thank you for joining us today. And today we're talking about something that was brought up in our last podcast, and we're gonna talk about it a little bit more and investigate some different perspectives.
Yeah, red light therapy.
Do you remember the technical term she told us?
No.
So it's photobiomodulation.
Photobiomodulation. Oh, that's right. Yeah.
Yeah. So like photo, just light, and then body, and then how you can change it. So everything has to have a complicated word for it as well.
Yeah. Photographic, biologic, modulation.
So
Nice.
red light therapy, probably this is a tracking cookie difference. I've seen a lot of red light therapy coming up for different indications, probably over the past year and a half, 2 years, but probably not in your pantry of tracking cookies.
I haven't seen any. Well, you know what? You're right. I haven't.
Okay. So red light therapy over the past year and a half that I've seen is mostly indicated for recovery, specifically athlete recovery. Also has some cosmetic indications for skin integrity, things like that.
Beautification.
Beautiful.
Blemish removal.
Is this the photobiomodulation version of red light? Like be able to make the beautification out of instead of better skin?
Yeah, I'll take it. Like I'm all about that.
Yeah. So there is science behind it, and we'll briefly talk about that part, and then we'll eventually end up with where does this stand for concussions?
Okay.
So the science behind it is essentially it's affecting the integrity of a cell, and there's a lot of focus on mitochondrial health.
Mitochondria, the little powerhouses of your cells, like the things that kind of like tell your cell, like, let's go do stuff.
Yeah, the energy source.
The energy source.
Yeah.
That's like ATP, like
ATP is, that's like the molecule of energy that can be produced.
adenosine triphosphate.
Yes.
Dr. Trav.
Dr. Travis here. But this is getting attention in all sorts of arenas, like even from gut microbiome, being able to affect general energy levels aside from athletic recovery or post-concussion. And I'm kind of curious, like there's so many other components of a cell. When are we going to start paying attention to like the lysosome? Like when are we going to have things that like the lysosomes are like they kind of clean up the trash in the cell.
Oh, yeah, yeah. Like, yeah, cells are complicated.
Yeah, and there's like the nucleus, which is like the brain.
Right.
So now that we're being so much more specific to components of a cell, the sky's the limit.
Like cells are so freaking interesting. Like they have these little channels that allow things to go through them. I don't remember what they're called.
So the membranes.
Yeah.
And they can allow certain ions to pass and other ones not.
Wait, and they're like lipids maybe on the outside, and they have tails and they're water resistant.
So lipid, yes, is water resistant. So lipid is just a fancy word for fat.
Okay.
But again, that's a photobiomodulation to
I've put on some lipid in the past couple of months.
Yeah. So there's different levels of permeability. So like how easy is it to let things in? And lipids are a little bit harder to penetrate for certain molecules in a cell.
And your mitochondria is in the
cell.
It's in the cell. It's like it's like part of that, like part of how your cell works.
Exactly.
And red light therapy, it like helps with the mitochondria.
Yes.
Like
so
it's like a energy drink for mitochondria. Like it's like a monster.
So the idea is that it can increase the ATP production. Like you said, like the ATP is the energy go-getter. And mitochondria produce that. So it's thought to enhance how much ATP can be produced through the mitochondria.
So when your ATP runs out, that's like when your muscles start to like hurt and burn and fatigue, when you just don't have that much energy left.
Another way to say that would be once all the ATP is used up, then you come into some compensatory mechanisms where the cell has to use other things for energy that you don't want it to. And that could be what you're thinking of in terms of like that muscle cramping or fatigue that leads to less desirable outcomes.
I gotcha.
So you'll want your body to use ATP as your energy source.
So it's like if you're doing reps in the gym and you're curling like 45 pounds and you're on your 30th rep, your ATP is all used up. And you just can't do it no more.
So the idea behind using red light therapy is it can theoretically reduce inflammation, and that would expedite recovery after something like that, after a lot of athletic exertion.
It boosts it faster.
Yeah, it allows your body to recover from that inflammatory response faster.
Okay.
The other side of that is also in the healing phases. So particularly for chronic wounds. And once a wound is new, it has your immune system's response. And it's kind of every resource that your immune system has through your lymphatic system goes to that area where there's that new wound. But a wound can become chronic and it doesn't get that same attention from your body. So the idea behind the red light therapy for wounds is stimulating a higher level of mitochondrial response. So there's more energy and attention to the area to stimulate healing.
So hold on, go back. So your lymphatic system is like your lymph nodes. All your, like, you know, people are like, oh, you got your lymph nodes, or your lymph nodes are swollen, and you got lymph nodes here and kind of all over your body. There's kind of a route in your body that your lymph nodes circulate through. And the mitochondria says, come here more,
draw attention.
Direct more traffic from the lymphatic circle of blood to that specific area.
Yes, to allow the cells to heal.
To give the cells some
more
oxygenated blood.
Yeah, to heal. And that's kind of a common misconception is sometimes when we see like a swollen knee, sometimes people can assume it's blood that's swelling, but your circulatory system that has blood is different than your lymphatic system that has swelling or inflammation. So as you explained, it's like a network through the body, but they're two separate networks of fluid, not the same.
Correct.
So the idea of promoting healing in that way is providing more resources for cells to be able to heal faster and have more energy to do so through the ATP growth or the ATP supplementation. So that's kind of where red light therapy has gotten its first stance. So for recovery after some sort of athletic exertion, energy levels, wound healing, and the thought is that it can help cell regeneration. So if we take that into the context of concussion, the assumption is we need cells to regenerate and heal faster. We need more neurotransmitter communication. We need that neurogenesis. So should red light therapy be used in that?
I mean, sounds right. And the cells that we're talking about when it comes to concussion are a little bit different than the cells that are in, like, say, like red blood cells. So when anybody says brain cell, they're talking about a neuron, and a neuron has like a cell body, and then it has this long tail, and that long tail is called an axon. And that axon is covered by this stuff called myelin. And that's just like a fatty covering that allows...
Made of lipids.
And it allows the electrical signal that your cell body generates to travel more smooth. It's like the coating on your spark plug wires, right? So it allows that electrical signal to go from the cell body, or say like the rotor of a car engine, and travel down through the axon or spark plug wire to the spark plug, say your dendritic cells, or not your dendritic cells, that's part of your immune system, but your dendrites. Your dendrites are on the end of that axon. And in those dendrites, they have these things called terminal buttons. And terminal buttons release different things like serotonin or oxytocin or dopamine. So imagine that, like when you feel good, right? Like, that is your cell body of the neuron sending an electrical signal down to the dendrites that say, hey, release some dopamine because I feel pretty good. And then that dopamine is then picked up by the next neuron in its dendrites. It's actually, there's dendrites on both sides of the neuron, but we won't get into that. But it just kind of sucks up that dopamine. And it tells that neuron to fire and send out more dopamine. So that's why, you feel good, because your neurons are sending out these signals to increase dopamine in like a linear fashion, I guess.
So neurotransmitters have a lot of communication properties, and they all happen very fast. And the example you gave of how like a spark plug or something that has to carry a signal, that part is the exact part that's influenced after concussion. The ability to transmit that signal without disruption, there's some shearing forces that can affect the integrity of that signal because it's now no longer protected by that sheath. There might be some shearing forces that disrupted that. So the signal does not get to its intended target as quickly.
Boom, there you go. If you're a mechanic, if you're somebody that knows anything about engines, a concussion is like never ever changing your spark plug wires, and you have a car with 500,000 miles on it, and you have the original spark plug wires, and they've also been stretched and
stretching part, yeah,
messed up, and just sometimes not put back on right, and water. That's what a concussion is. It's completely damaged,
shearing that connection.
It's ruining your spark plug wires.
Yeah. So the idea behind the red light therapy is if we know it has an influence, a positive influence in cell health and cell regeneration, then it should help in that neurogenesis process, and it should help reduce inflammation after concussion. And reducing inflammation is really only applicable for those early stages after a concussion.
Reducing inflammation is
really when you first
first.
So like someone who's 3 years out, we'd have to ask a neuroscientist, but I don't think inflammation is the primary obstacle at that point. But initially it is. That's the driver of all those severe symptoms initially.
Gotcha.
So there's more fluid in the brain, more pressure, more disruption to that communication between cells. And if the thought is red light therapy reduces inflammation in the body at a cellular level, it should have applications there. But the one thing that really stands out to me as a barrier is just with the nature of why this injury is so complicated, the brain is protected by a skull.
Yes.
That thick bone makes it like any other body part. If we want to improve circulation, you could even just massage that area, but you can't do that to a brain. It's confined and protected by this skull. So the chances of getting your target, which is the brain, through the skull, to me seems more complicated.
Right.
Because everything else that you're treating with red light therapy, your skin, inflammation, muscle, everything else is much more superficial. And I could visualize how that light can penetrate in that way. But when they're using red light therapy for concussions, it is transcranial. But how do we know we're actually penetrating the skull? Because that same concept turned out to, on the physical therapy side, be a big factor when we used to use ultrasound for everything. Like back in the late 80s, early 90s, if your back hurt, you would go into the clinic, somebody would pull out an ultrasound wand. And it wasn't like the ultrasound that produces a picture, it was just sound waves.
Okay.
That was thought to bring more oxygenated blood cells to the area to facilitate healing. And they would do an ultrasound on your lower back, or let's say your hamstrings hurt, or name the body part. You would get sometimes 10 or 15 minutes of this ultrasound. So it's a gel and a wand.
Okay.
And they would do that for everything. And everyone assumed, well, we know the science behind why ultrasound should work, so this should help all these people. It wasn't until much later that they found out that the level of penetration of that ultrasound wand is nowhere near what we thought it was. So you can even take that sound head, dip it in water, and watch the ripples, and it's maybe penetrating a half a centimeter or so. So it turns out that what we thought was helping was actually just the mechanical response of the ultrasound wand and the warm gel on the body part. Penetration of the therapeutic value is a big factor in, is this helpful or not? So,
and it probably took them 10 to 15 years to freaking even realize that, because
and believe it or not,
slow.
Things were slow. And believe it or not, there's still some therapists that still use it for broad-based injuries and broad body parts. There is some science to validate using it, like for a lateral epicondylitis, like if you have like a tennis elbow and it's really superficial, like I can touch exactly where
I
that.
can feel my tendon.
Then ultrasound could be helpful there, or like a lateral ankle sprain or something like that. There is some evidence of it there, but there's still some therapists that maybe got their license back when ultrasound was assumed to be the cure-all that are still using it. Okay. All that just to kind of bring up the idea of, does that red light therapy penetrate the skull? We don't know. So that's why there has to be studies done. So like the science can be accepted. Like it can be known that red light therapy has these influences, but the halting point is, does research validate that it's helpful for everyone to use it? Is it something that should be recommended?
And it's going to take us 15 years to learn that.
So there has been some studies done. I brought a couple of them. So, and again, my search is limited to what I have access through from my professional organization database. So if you're listening to this podcast and you know of a study that validates it in a different way than we're discussing, please send it along. We'll review it, discuss it, just because that's really important to make sure we're getting many different perspectives involved.
Yeah, leave it in the comment section. We'd love to see that.
And we'll put the citations in for the articles that we're going to cover. But we're just going to go through 3 of them because it can be exhausting to go through all of them. But I picked ones that are all different types of studies.
Okay. Is this like PubMed stuff?
Kind of.
Okay.
Kind of. Same idea of like reviewing formal research that's been conducted, not like what the internet says when you're, so like if you go on a website of a place that does red light therapy, you're only going to see those
good stuff,
those scientific principles without it actually being studied on individuals in that specific population.
I gotcha.
Right. So we're looking at specifically post-concussion. So the 3 that I found are all recent, obviously, because this is new.
Yeah.
It's a new idea. And it was looking at whether, so the first one, I'll read the title of it and then we'll discuss why research can be unnecessarily complicated. Treatment of chronic symptoms following mild traumatic brain injury with transcranial LED, a sham run-in pilot study of photobiomodulation therapy.
Who names these things?
Yeah.
I could name that something way cooler.
I mean, it all makes sense. It's just that understanding like the type of study can be complicated, like a sham run-in pilot study. So pilot is just taking a look at it for the first time. So that part makes sense. But the run-in period is a period before the main trial starts where they might receive like a standard of care treatment. And then you observe what happens. And then afterwards, they're exposed to the intervention of interest.
Isn't a sham though like a freaking, what do you call it? Like a ruse, a sham. We're shamming you here. Like this is just a sham.
Yes.
Or a chamois. Sham wow.
Sham exactly is that. It's just something to make you think. It's almost like a placebo, but it's more like intervention based. So like a placebo in a general term is we have 2 pills. One is a sugar pill. One is this chemical compound that we expect to have this output. That's kind of similar, except for in the sham side of things, it's more so what the exposure or the intervention part could be.
Okay, I gotcha.
Okay. So an important part of understanding these is you want to look at how many people did they test, right? Because like if they're doing this on 2,000 people versus 2 people,
yeah,
that means something very different.
Big time.
Yeah. So they were looking at symptom reduction. So does exposing these post-concussion individuals to red light therapy improve their symptoms? So they had 3 men and 6 women as our participants. Their age range was from 22 to 61.
Okay, big age range.
Yep, total of 9 people.
9 people.
They had a 6-week intervention period involving 18 40-minute transcranial sessions.
Okay.
And then after that, they looked at 2 weeks after, 1 month after, and 2 months after. So they looked at essentially all their neuropsych testing. So things that would some sort have an implication on cognition, depression scores, things that would be disruptive at this phase of a concussion. There was not much improvement, but keep in mind, there were only 9 participants. Out of them, 2 showed improvement on their neuropsych testing. So that means 7 did not. Now, an important part of this is, as Mandy told us last time, the psychological symptoms after concussion are pretty impactful. And if you believe you're not going to get better, you're not going to get better. And if you're this far out from your concussion, that might be part of your belief system. So, number 1, small sample size. And obviously they acknowledge it's just a pilot study just to get an idea of is this helpful or not. But the implications for improvement are how they perform on neuropsych testing, which are heavily influenced by the psychological symptoms of the concussion.
Very complicated.
Right. So just from even my perspective, when I have patients that have, maybe they're starting to see me 1 year out or 2 years out from their concussion, that is a massive barrier. Is the perception of how they're doing oftentimes will dictate how they think they're doing. But if we have noticeable objective changes, if we don't take the time to illustrate that in a meaningful way in their life, they won't see that improvement.
Say that one more time.
So if they've been suffering with these symptoms for sometimes a year, 2 years, I've had even longer periods of time than that before they start the rehab process, their belief system, the psychological influence, is a bigger determining factor of their perceived level of recovery than the objective level of recovery. Say, for instance, we have a standardized test that we know is reliable. It's been validated in research. It's effective for assessing what we think it's going to assess. Let's say something like balance, and that affects their ability to go for a hike, play with their kids, be involved in sports. And we know objectively that's improved tremendously. But if I were to ask that person, how are you feeling? Has anything improved over the past month? And they say no, oftentimes it's more of an influence of the psychological symptoms than the objective measures that we're gathering. So if I don't take the time to show them where they started, where they are now, and what they've told me over the past month they've started doing, we're still met by that same barrier of what the psychological influence from the concussion may be.
The psychological effects of concussion recovery and belief.
Yeah.
Up next on concussion.
That's a very complicated topic.
Oh, so that would be like, yeah, I love that. Like I love, how does belief make you transcend into a different state of reality? And if you get stuck in that, just
perpetual suffering. And like the statement Mandy gave behind it was pretty powerful, but what she was discussing with emotional regulation is if we know that that's compromised, and then we're expecting them to follow what can be an emotional journey through the recovery, that part might be stagnant. So there's so many other factors to be able to assess if this is helpful or not. And the trouble is if we're relying on neuropsych testing or relying on their symptom report, that psychological component can compromise what we're seeing. Or it could mean that the red light therapy was not as effective as we thought it was.
We have to study it to find out.
Exactly. We have to keep studying it to find out. And all the ones that I found were 2024 or newer. There were a couple from 2025. So that's how early the investigation is. So just because one study says it's not necessarily helpful doesn't mean it's not. It has to go through a rigorous course of different types of trials, different sample sizes, different times since injury to be able to get really good information. So the next one is impact of photobiomodulation on objective psychological measures of brain function in individuals with post-concussion syndrome. So notice how this one says on objective physiological. I'm sorry, I mispronounced. I said psychological. I'll read that again. Impact of photobiomodulation on objective physiological measures of brain function on individuals with post-concussion syndrome.
Again, who names these things?
But now we're looking on things that are not necessarily as influenced from the psychological symptoms.
Okay.
So in this study, again, it was done in 2024. It was published actually in July of 2025, this month. So they were looking at what's known about the metabolic capacity of neurons and what is assumed to be stimulated in the anti-inflammatory, antioxidant responses and neurogenesis. So as you talked about, new cells that help transfer brain signals from one area to the other. So they were looking at what is known to be a benefit in treating other neurological things, such as strokes, depression, even dementia and Parkinson's disease, which is a totally different topic. So they were looking at how this light can affect these post-concussion symptoms. And it got to the same kind of finding of not necessarily conclusive. So again, early phases, looking at a lot of impact at a cellular level. And what this does is it takes out the changes that the patient would report And instead, they're using images to figure out what the physiological changes are. Pointing in a much different direction, but again, still illustrating like larger sample sizes are needed, better control groups. Because how do we know that just applying this red light therapy to someone who's never had a concussion would have the same impact? Does that physiological change actually influence this person's recovery?
Yeah, control. It's good to have a controlled group when you're doing a study.
Yes. And then the last one. So the last one was a randomized, double-blind, placebo-controlled clinical trial.
That's the granddaddy of all experiments.
That's why we save this guy for last.
Boom. How about that?
Yeah. Randomized controlled trials and double-blind even are really the ones you want to pay attention to. All right. So let's get down to the specific findings here. Go down this way. So after adjusting for the effect of previous number of concussions, they essentially found that there was no significant difference between the treatment and placebo group at 3 or 6 weeks of treatment. So despite showing promise in previous investigations, our study did not show the benefit over the placebo in patients experiencing persistent post-concussion symptoms.
Okay. And that's just one study. Yeah, I mean, that's the study. That's like the study, though. Like, that's the granddaddy of.
But then again, there's also granddaddy of studies that show faster healing times when they're being exposed to that. But the reason why there's still so much research going on is because people who are signing up for that study might have a different belief system in their recovery. If they're looking for things that are going to help them.
So if I believe that this red light therapy is going to help me get better, it will it's more likely to make me better.
Or even the phase that you're at now, you signed up for a clinical trial, a study. Your belief system going into that is expecting to get better. So that's another massive variable in these studies is people that are seeking these out or willing to participate might have more aptitude for recovery, regardless of the intervention, just because of their
belief system as something that I really feel like we should talk about. Like, that's amazing.
It's fascinating. And then like I said, I just picked 3 just for the sake of discussion. There are other studies that show red light therapy is effective. It's just not as compelling to talk about in terms of where we want to think of where we want to have our mindset when we're looking at different research and how it's conducted. And even for, Mandy's position, I'm not in a position where I can prescribe things or refer to those types of things. So I'm purely in an interested mindset. What helps, what doesn't help, what's been shown in different studies to help. Same thing with like hyperbaric oxygen. It's shown to be very helpful in some studies, and then in other studies, it's like, could be or couldn't be. That's what we want to have the same approach with red light therapy. Instead of having this assumption that it's going to cure or fix whatever's going on, we want to go through all the studies and think about how those results could have been influenced by so many different variables.
Yeah, because there's a lot of variables.
And to me, the biggest one that stands out is the skull.
The skull. So
the physical barrier.
So I asked our friend old ChatGPT 40, whatever that
40.
Can red light penetrate the skull? And ChatGPT can sometimes be wrong.
Yes,
so we don't fully rely on that, but we get a little perspective of what it thinks, and then we'll verify what it says. And so I asked, can red light penetrate the skull? And it says yes, but with limits. Red and near infrared light can penetrate the skull and reach superficial regions of the brain, but how much gets through depends on several factors. The wavelength of red light, 620 to 700 nanometers, has moderate penetration, but most of it gets absorbed or scattered in the skin and bone. Near infrared, 800 to 1100 nanometers, penetrates deeper and more efficiently, with some wavelengths around 810 to 1064 shown to reach cortical tissue. Think of it like trying to shine a flashlight through a foggy window. Red light scatters more. Near infrared is a cleaner beam. So it's basically like using your high beams in the fog and using your low beams in the fog. Like, you want to use your low beams because they're kind of not they don't get as scattered. And that's kind of what like red light is. It's like turning on your low beams in the fog.
So that's helpful for me to know too, as to like, yes, it can, but it's estimating that it's just essentially going to reach cortical levels. But then again, for the indications that she mentioned, the cortical levels often are going to be the ones you want to influence if fatigue is a big factor. If your brain is having to work really hard to be able to get cognition, motor commands, eye coordination, all those things that have to happen in the brain, all of that can be very helpful to have some cellular healing at those known penetration levels.
And I guess it says here, the next part is how far can it go into the brain? It's enough to reach the prefrontal cortex. That's like the outer layer of your brain. That's like the part that when you think of a brain, like that's what you think of, like the folds and the little lines going through and the brain-like thing that you picture. Like that's the prefrontal cortex.
That's a section of that.
Yeah, the front section of that. And that's kind of where we get all our thinking and processing and we know that next week is what we got to do next week, and we can solve problems and things like that. So I guess that ChatGPT right now is saying that it can get into that. It can get into your motor cortex, and we've talked about that before, and possibly deeper regions with reflection and refraction effects. But attenuation increases exponentially.
So this is another example of the science is backed up. Like in order to reach that, there had to be a lot of understanding and out of human experiments to be able to understand that, because knowing that something can have this effect, but does that effect reach the functional result that we're looking for is really important.
Yeah.
So let me think of another way to do this. So several years ago, probably about 5 years ago, I had a patient who was far out from his concussion, had been through traditional PT, and then saw a concussion specialist, was rerouted to, I know you did physical therapy before, but you need to go do this kind of concussion-specific physical therapy. And as you can imagine, the psychological effects, emotional regulation that he had to become accustomed to was a very deep hole to get out of. And we were making objective improvements, things were coming along, but still that the way he saw himself was still affected by all those psychological components. And then his wife had a baby, and things changed for him drastically.
After the baby.
Yes.
Yeah.
So we can imagine that changes how he sees himself. He now has a much more important role. Somebody's depending on him. There's probably a heck of a lot more dopamine response.
Yeah.
He's got a child.
And serotonin and oxytocin.
So we know that there's some science there as to why. But does that mean everyone that's had a concussion and still has symptoms 5 years out needs to have a baby?
I wouldn't recommend it. I mean, exactly. I love babies. Babies are great.
But it just means that the solution is not uniform.
The same for everybody.
Right. Like just because something helps somebody and we know that scientifically there's basis for it, it doesn't mean that that's now the solution.
Right. If you get a concussion, it's not recommended to like a baby is going to fix it. Just like maybe this specific therapy wouldn't work for you because who knows what you've been through in life and your belief system. So
that's an important consideration with all these things that do help. Now, that's an extreme example just to paint the picture that we know, obviously, the solution for everybody is not to have a baby to fix your concussion.
It does give you purpose, though.
But that doesn't mean if you're 17 years old,
right? No,
that's the solution for you. But that's, like I said, that's just an example to kind of help illustrate what we're after here, that not what helps somebody in a specific way doesn't mean it's going to be the solution for everybody. So there's a lot more research that's being done on this red light therapy specifically, because I remember even more recently, cold plunging was the thing. Do you remember that? Everybody was cold plunging. And all it did
cold shower
was make them cold. So all those physiological effects that could be justified through science weren't necessarily extrapolated out when we looked at a large group of people, those who were cold plunging and those who were not.
Did you ever do that? Do you get like ice cold showers?
No,
you don't do. So I actually in the summertime, like every shower I get is like all the way on cold, like the coldest. So I don't know. I like it.
Okay.
I mean, I don't think it helps me or does anything.
Well, that's the difference, is like something you enjoy versus something that's therapeutic, you know?
Yeah.
But that's just an example of like how we have to be so skeptical as to what we relay to patients, because until there's something, like you mentioned, a randomized controlled trial, double blind, something that shows us this is in fact helpful, we could be spinning their wheels, doing all these other things that happen to help some people.
But not everybody.
We don't have anything to rely on that this will help you. And even the most validated interventions, it won't help everybody.
Right. Almost like that's the reason it takes 10 to 15 years to get that definitive, like this will help everybody.
Well, that 10 to 15 years is even after you have that definitive, this will help everybody.
Oh,
for it to reach people.
Oh, so even after you know.
Even after you know, it's taking over a decade and a half for it to change what the recommendations are from the healthcare industry.
That's crazy.
Yeah. So that's not even the investigation time frame. So you could spend 30 years studying something, and then you land on this granddaddy of all research. We know for certain this helps. From that point, it takes over a decade and a half for it to change what we do.
Unless you're listening to this podcast and subscribed, because we're bringing you the latest up-to-date information on concussions.
And so far, all we've done is share how to scrutinize research.
Yes.
Just to be a more critical thinker about it, because in this, if you're in this situation in a post-concussion phase, anything that will help you want to try. Red light therapy has helped some patients. It might be something you want to try. We cannot recommend or recommend against it. But all we're doing is just discussing, if it weren't to help you, there's so many other factors that go into these studies that say it may help you. And your doctor is going to be the only one that's going to help guide you through that, because they know all the factors that you have coming into this. They might even know you have contraindications to exposure to red light therapy, in which case it would not be good for you.
Contraindications.
So do you know what that means?
No. Contra is a video game.
Oh, really?
Back in the 80s, yeah.
What kind of video game was it?
Up, down, left, right, A, B, start.
That was Contra?
So that was the code to get 30 men.
To get 30 men.
You pressed that in when you started playing at the loading screen, and it was like a cheat code, and it got you 30 men. Now, everybody knows that.
Not everybody. How did you come across that cheat code?
At lunch table. When I was in
who figured that out? Who put in these series of, and who knows if that entire series was necessary? What if it was just the first 2 buttons that you pushed, but everyone was saying that the cheat code was all 16 buttons that you pushed, and the other 14 didn't matter?
Was that how many it was?
I don't know. I was just guessing. Go ahead. I'll count.
Up, down, left, right, A, B, start.
Okay. 13.
13.
It's a little shy there.
Anyway. Worked. But that worked.
Well, how do you know that just the first 4 didn't work?
I don't know that. I'd have to get a Nintendo.
A control trial on that.
We should. Does anybody have a Nintendo out there?
So this is old school Nintendo?
Oh, yeah. This is like when I was a kid. I still ask my mom where my Nintendo is. I'm like, what'd you ever do with my Nintendo?
And what'd she say?
She's like, Travis, that was like over 35 years ago. I don't know. And I'm like,
sold at a yard sale?
I don't know what happened. I'm still looking for it.
I mean, if you find it, that would sell for a lot of money at a yard sale.
Oh, yeah. I wouldn't sell it.
Whenever they do yard sales in my neighborhood, people come through and say, do you have any old electronics or video games?
Nintendo.
I tell them about my massive movie collection.
Yes.
No. So if you do find it, let me know. So Contra, you could do that code to get 30 extra men, but what was the purpose of the game?
Oh, it was like you're this, there's these aliens that have taken over planet Earth, I guess. And you're this like war guy. And you have to get to the main alien and kill him.
Okay.
And it's so cool. That's a cool game.
Okay.
That was one of my favorites as a kid.
And it was called Contra. And all you're doing is trying to find an alien and kill him.
Well, so you're like this muscle-bound warrior, and these little things come flying through the screen, and you grab them, and they would give you different type of guns. Like you could have like spread. Spread was the best.
I'm trying to find some sort of parallel here where something in the game means something you weren't supposed to do. So like there's an indication, meaning this is for you. A contraindication means this is not for you. So riding a roller coaster when you're 9 months pregnant. Contraindicated. Yeah. And then controversial. Like it will have ill effects.
And
then there's precautions. So precautions are things that you need to consider. So I'd say like a precaution would be if somebody is probably 3 months pregnant, and it probably shouldn't do that, but there's no science to say it will be harmful if you do.
Gotcha.
So those are indications, contraindications, and precautions.
Gotcha.
Yeah. So all that's just kind of goes through everything from a treatment, a procedure, anything along those lines. We'll use those terms.
Cool.
Yep. So that's our experience of scrutinizing science for concussion interventions.
Yeah.
And the whole concept behind red light therapy is just very fascinating to be able to influence the mitochondria and ATP production. And I'm kind of curious where things are going to go with understanding other components of the cell. And like I said, the gut health the individuals studying gut health, gut permeability, leaky gut, all that. I think they have been the masterminds behind scientists taking a step back and looking at things at a more biological level, like the permeability of cells, the communication between cells, the strength of cells. So there might be a lot more to come after we study the mitochondria very well to understand everything that influences it. And then maybe we'll start to understand the influence of other areas of the cell.
Yeah.
Thank you.
Mitochondria, red light. We'll see.
We'll see. But yeah, thank you all for joining us, and we'll catch you next time.
Yeah. Thanks, everybody. Like I said, if you have any experience with red light therapy, leave a comment, share it with somebody that you may think needs it. We'd love to hear we'd love to get some more specific data on that. So if you've done red light therapy and it hasn't worked, let us know. If you've done it and it's worked, let us know. And then maybe we can talk about belief systems on a future episode.
That sounds like that's going to be Travis's next episode, is belief systems after concussion.
That's great. That sounds great.
Yeah.
I'm all about that.